Good evening, all of you.
Good evening, ma'am. Good evening, everyone.
Let's start our section. Yes. So let me invite Yomi ma'am, Minu ma'am, and Yomi ma'am. Yes, you can start.
Good evening, one and all present here. Today from National Child Development Council, Rising Twin Circle, we are going to organize a webinar on pediatric oral health, facts and myths. So in this, we have written as quote like, give yourself a reason to smile. Yes. So being the reason, some reason for smile is very important to everyone. So nothing we wear is more important than the smile. So for that, oral hygiene is very, very important. For that, we have invited a very special guest over here. Was our resource person is Dr. Meenu ma'am. I want to welcome you, ma'am. So before starting our program, let me see one small thing. Every tooth in a man's head is more valuable than a diamond. That is one of the superb quote where I have read that. So it is very important to teach the children about the importance of oral hygiene and also how to look after their teeth, and also parents should get this about a very good knowledge about this. This is very, very important topic. So we are so happy and glad to have this webinar on this very, very special day. Before start going to our program, let me call Minu ma'am for start our webinar with our prayer song. Welcome, Minu ma'am.
Thank you, ma'am. Thank you, ma'am. God bless me always. I am your little baby. Please protect me. You are my papa. You are my mama. You are my world as well. Pat me always, hug me always, with your invisible hand. I can see you in a rainfall. I can see you in wind. I can touch you, but I feel you always in my mind. Always in my mind.
Thank you, Minu ma'am.
Thank you, Minu ma'am. Yes, Minu ma'am. So after our superb prayer song, shall we invite our Yomi ma'am for to give a welcome speech for our guest?
Yes, without a welcome speech, how can we start our program? Yes.
Yes,
Welcome,
ma'am.
Yomi ma'am.
Thank you so
Welcome,
much.
Yomi ma'am.
Before that, this webinar is organized by the Rising Queens. So to know more about the Rising Queens and NCDC, I'm gonna share one video, and all the related informations, we can watch it here. So here I go. My screen is visible, right?
Yes, ma'am.
activities, make it as a family, and even after their course, they are always are spread all over the world and always connected to us virtually.
Hello everyone, I'm Yaomi Chonrugui. I'm from Manipur. I belong to the 27th online batch of this National Child Development Council. I'm doing a post-graduation diploma in International Montessori Education. By joining this course, I can see a lot of improvement in myself. This course is full of activities. It's an activity-oriented course, and every day we have 2 hours online class. And it's difficult being a married woman to go out, attend college and learn. But this National Child Development Council has provided a platform for ladies to stay at home and learn at our convenient time. So here I practice so many life skills, and it's very fun to attend the class. The faculties are very friendly. My faculty is Shirin ma'am, who is always encouraging, who is always inspiring. So I learn with fun, and I learn so many things from my friends also. All the faculties, all the staffs, and also evaluators are very encouraging and supportive. And by joining this course, I get to refine my skills of a teacher. I learn about child psychology. I learn about the philosophy of this Montessori education, about the various approaches of teaching and learning. And also we have practicals of how to conduct a class, how to let the kids attentive, and we got to learn about so many crafts which we can be used as teaching aid also. And here especially we learn how to be a successful and how to be an inspiring teacher. All the skills and all the requirements that a successful teacher needs to possess, we learn it here and we get trained here. So I'm very grateful to this National Child Development Council, and everything is fun. We are given 50 hours of English fluency class also. So many activities helps us to enhance our vocabulary, to improve our thinking and reasoning capacity also. It's all fun. And so I have so many things to say more, but I want to conclude by saying that this NCDC is a platform perfect for ladies to unlock our potentials, to refine our skills, and to discover ourselves. So thank you so much.
Hi everyone, my name is Anandi. நான் கோயம்புத்தூர்ல இருக்கேன். நேஷனல் சைல்ட் டெவலப்மெண்ட் கவுன்சிலில் போஸ்ட் கிராஜுவேஷன் டிப்ளமோ இன் இன்டர்நேஷ்னல் மாண்டெசரி கோர்ஸ் கம்ப்ளீட் பண்ணியிருக்கேன். ஸோ என்னோடய 1 year எக்ஸ்பீரியன்ஸை நான் இங்கே ஷேர் பண்ணணும்னு சொன்னால், நான் நர்சிங் முடிச்சுட்டு என்னுடைய கெரியர் மிஸ் பண்ணிவிட்டு ஹவுஸ் ஒய்ஃபாக 2 கிட்ஸ்க்கு மதராக வீட்டில் வெயிட் பண்ணிட்டு இருந்தேன், ஏதாச்சும் நெக்ஸ்ட் ஆப்பர்ச்சுனிட்டி கிடைக்குமான்னு சொல்லிட்டு. ஸோ எனக்கு நேஷ்னல் சைல்ட் டெவலப்மெண்ட் கவுன்சில் பற்றி தெரிய வந்தது, என்சிடிசி பற்றி நல்ல ஃபீட்பேக் எனக்கு கிடைச்சிது. அதனால் நான் ஜாயின் பண்ணிவிட்டு நான் கேட்ட ஃபீட்பேக் எல்லாமே 100% ட்ரூ. ஏன்னா ஆக்டிவிட்டி ஓரியன்ட் பேசிஸில் இந்த கிளாஸ் எடுக்கிறாங்க. ஸோ ஆக்டிவிட்டி ஓரியன்டாக இருக்கிறதுனால எனக்கு எந்த ஒரு பேர்டனும் இல்லாமல் நான் இந்த கோர்ஸ் கம்ப்ளீட் பண்ண எனக்கு ரொம்ப ஈஸியாக இருந்தது. டீச்சர் ட்ரைனிங் கோர்ஸ் இவ்வளோ என்ஜாய்மெண்ட் பேசிஸில் வேறு எங்குமே எடுக்க மாட்டாங்க. அந்த மாதிரி ஒரு நல்ல ஒரு பெனிஃபிட்டடான கிளாஸு. ஏன் பெனிஃபிட்ஸ் much.
मैं NCDC पाठ्यक्रम में अपनी यात्रा के बारे में साझा करने जा रहा हूँ। मैं अंग्रेजी माध्यम स्कूल में पढ़ता हूँ। मैं दायरा प्रवाह अंग्रेजी में बात नहीं कर पा रहा था और जब भी मुझे दूसरे के सामने कोई कार्यक्रम करने का मौका मिलता है तो मुझे मन से डर लगाता रहा था। इसलिए इस कक्षा में शामिल होने के बाद मैं एक गृहिणी से एक शिक्षक के रूप में बहुत कुछ बदला है। इसलिए मैं NCDC का हिस्सा बनकर खुश हूँ। थैंक यू।
We provide different courses to ladies without any age limit. The courses are Certificate in International Preschool Education, Certificate in International Montessori Education, Diploma in International Montessori Education, Advanced Diploma in International Montessori Education, Postgraduate Diploma in International Montessori Education.
Yes, so that video I shared, it provides information about this Rising Queen and also about NCDC. Now I want to move on to my welcome speech. First and foremost, I want to welcome our resource person for today's webinar, that is our respected Dr. Minu Prasannan. If I pronounce it wrong, it's my apologies, ma'am. So we would like to give our heartfelt welcome to you, ma'am, because in spite of all your busy schedule and in spite of all your works, you are spending time for us to join with us for this webinar. So we welcome you, ma'am. And also, I want to welcome, in his absence, I want to welcome the master trainer of this National Child Development Council, that is our Baba Alexander sir, who is also a Global Goodwill Ambassador. I want to welcome our Baba sir also. Along with him, I want to welcome our senior evaluators, our senior faculties, NCDC team, and all the well-wishers who are in this program, and also those who are watching live. And also all my friends, I want to welcome you all. And I want to express not really a word of thanks. I want to express my thanks to the Rising Queen team also. Sherin ma'am, not only the coordinator of this Rising Queen, but she's the one who bring this amazing guest in our webinar today. So thanks to Sherin ma'am and all the other members of this Rising Queens, Kartika ma'am, Lindsay ma'am, Ananti ma'am, Minu ma'am, thank you. So before I invite our guest, I want to say a short thing about her. I'm sure she is a lady who is beautiful from the heart. Just look at her, we can see that she is beautifully inside out, and she is also beauty with brain. She is from Trivandrum, India, and she has many work experience, but I will just highlight some. She is, yes, she's a pediatric dental specialist by profession, and she's an entrepreneur by passion. And she has also an online store, designer store. And she's also a writer. She's a fashion consultant and a counselor. And she has also a basic training in child psychology. She is ready with solving real life problems, including moral boosting, family and relationship counseling. So seeing all this, we can say that she's a multi-talented lady. Really appreciate you, ma'am. And so I want to highlight some of her. She has so many work experience, but to highlight some, she was the former senior lecturer at BSM College of Dental Science and Research. She was former consultant pediatric dentist at DLC Dental Clinic, and she worked at Crowning Glory Dental Center. And she is also a consultant pedodontist at Modern Dental Clinic. And I guess recently she is working as pediatric dental specialist at Government District Hospital, Trishu. So there are so many things to say more, but we want to say to our Dr. Minu Prasannan ma'am that we are so happy that you are here today. Thank you so much for coming to this webinar, and we all are looking forward to learn so many things from you. So this entire session is handing over to you. So over to you, Dr. Minu ma'am. You can take your time.
Thank you so much.
Welcome you, ma'am. Welcome, ma'am.
I'll share my screen.
Yes, I think ma'am is preparing to share her slides. Yes, we can see your screen, ma'am.
So I would like to start off with saying that children are the world's most valuable resource and its best hope for the future. So the wealth of a nation, I would say, is not merely on its economical and natural resources, but it is more decidedly on the quality of the nation's children and the youth. So therefore, it becomes very mandatory for every nation and society to nurture the strong, healthy, and to bring about a healthy individual, citizens, intellectually strong children. So, what is health? According to World Health Organization, health is a state of complete physical, mental, and social well-being, and it is not merely the absence of any disease. So, when you say you are healthy, it is not just it doesn't just mean that you are you don't have any disease. It means that you are physically sound, mentally sound, and socially sound. If you have any issues with any of these, you can't call yourself healthy. So most parents know the basics of keeping their child healthy by giving them adequate nutritious diet, giving them proper exercise, providing them proper sleep. But apart from all this, it is also important for them to take the kids for regular checkups with your doctors. I wouldn't say only the dentist, but doctors as such, like more importantly to medical doctors and to dentists also. So coming to the topic of our discussion today, it is pediatric oral health, the facts and the myths, because there are so many myths associated with pediatric oral health. I would like to clear some of them too. And I'm extremely happy and I'm grateful to Mrs. Sharon and NCDC for having me here. And I sincerely hope that this session will be extremely beneficial to all those who are attending in throwing light on all the aspects of pediatric oral health. I would like to introduce myself. I am Dr. Minu Prasannan. As I was introduced, I am a pediatric dental specialist at Government General Hospital, Thrissur. And I'm also working as a consultant at various private hospitals and clinics in and around Thrissur and Malappuram district. So I intend to bring clarity on all the important aspects to be known regarding a child's oral health and the common myths we often come across, and also the actual facts about the same. So for this, I would be covering this topic age-wise, right from when a newborn is born up till until he or she turns 15 to 16 years, so that we can best relate to the situations and how to tackle each situation. Because most of people I guess are not very much into medical field, or so it is. I think it is best to cover it age wise so that you can relate it to your kids, or if there are expecting mothers, you can relate it better. So starting with the first 6 months of life, that is like 0 to 6 months, usually infants don't have teeth. So the first teeth usually erupts by 6 months of age, and their main diet is milk, the mother's milk. Now, what is the most important is that oral hygiene habits, that is the cleaning of the mouth, should start from early on in the life. The gums without the teeth, the gums which are present in a newborn's mouth without any teeth, they are referred to as gum pads. So gum pad cleaning, as shown in this picture, gum pad cleaning should begin as and when they are having their milk. So they should be cleaned as shown in this picture using a sterile cotton cloth or gauze wound around the finger. So each time the child is fed, you should clean the child's gum pads using a sterile cotton cloth. And this is because even the mother's milk is sweet, and the presence of this when the tooth erupts can cause decay. And so cleaning is important. And if due to any circumstance we are switching to formula drink or other supplements, care should be taken not to add extra sugar to it, because it is the sugar additive or the milk as such which causes decay in the milk teeth. And once the baby starts weaning is once the baby starts semi-solids and solids food apart from the mother's milk or the formula drink, that is when we should give at least a spoon of water after each feed, if possible, like after night feed, especially after night feed, because they sleep off suckling the milk, and that the last milk which they have taken in, they tend to pool around the newly erupted teeth, and the teeth will start to decay. So it is always better to wash down the last taken milk with at least a spoon of water. And why this should be done, I'll tell you in the coming slides. Coming to teething. Teething is a process where the first teeth erupts. First teeth erupts generally by 6 months of age. That is the general age at which the tooth erupts. It can be as late as 9 to 11 months also. There is absolutely nothing to worry. Theory says that it's the first tooth erupts by 6 months, but it can be as late as 11 months too. And usually it is a lower front teeth that erupts first, and the process is referred to as teething. It can be the upper teeth also, and the lower teeth might erupt second, but generally it is the lower front teeth which erupts first. So during this phase, the baby will appear generally irritable and may present with one or all of these signs which are shown in the picture. That is refusal to feed, might cry in throughout the night, might bite the mother's nipple, causing pain, keeps waking up in the night, shows irritability. There will be excessive salivary drooling, saliva keeps drooling, and there will be teething rash associated. Where the tooth is about to erupt, there will be a rash seen, reddish rash seen. So what can be done to ease the symptoms? Babies we can elevate their symptoms, because there'll be fever, associated fever also. So fever should be controlled with medicines and sponge massage. The pain and the irritation makes them to bite and chew on anything they can get their hands on. So it is at this point that you can give them silicone baby safe teethers. This picture shows the teethers which are commercially available. So you can give them after sterilizing them each day. So make sure that you sterilize the teethers each day, and you can refrigerate it for better, like not freeze them, but refrigerate them, so that the cold teethers will help in numbing the gum pads and will fasten the process of eruption. So by 2.5 to 3 years, generally by 2.5 to 3 years, they'll have all their 20 milk teeth. The number of milk teeth in a child's mouth are 20, which usually shed off by from 6 years to 11 to 12 years, and the other permanent teeth erupt, which are 32 in number. So that is a normal process that takes place. The teeth erupting by 6 months, and by usually 2.5 to 3 years, all the 20 milk teeth erupt. There is something called natal and neonatal teeth. That is, some babies are born with one or two tiny front teeth, or they appear during the first month of life. So usually they are born with the front teeth. So that is called the natal teeth. The issues associated with these teeth are that many a times they are very mobile, so the chances of them getting swallowed are high. And secondly, they can cause pain to the mothers due to biting on the tender nipples. So these are actually okay. Often the reason why parents come to us is because after each feed or while feeding, they cry very violently, and the parents are clueless as to why the baby is crying. Because usually, as seen in this picture, these natural teeth are associated with ulcers on the undersurface of the tongue, because the tongue is usually protruded to create suction while suckling milk. So due to this, when the the babies are brought to us with this complaint, we usually remove them. So it is usually safe to remove these teeth if the baby is more than 10 days old, and if it has to be removed before 10 days, we'll give them a vitamin K supplement, and then remove the tooth, because otherwise baby will have bleeding. Now, early childhood caries. I'm sorry with the spelling. So many of you would have come across these conditions like these, which are seen in this picture. And this is referred to as early childhood caries. Caries is nothing but tooth decay. So, and this is the most common reason as to why parents come with their kids to us. So it is to prevent this type of tooth decay that I told you about, the oral hygiene habits, like cleaning gum pads and giving a sip of water after feeding before a couple of slides. And the most common cause is due to the milk pooling around the teeth and the sweeteners which are added to the milk. So what can be done? These decay, the type of decay which we saw in the previous slide, it can be prevented by using tooth cream by the name GC tooth mousse. This is something which is to prevent, that is, you can prevent the occurrence. As soon as the first tooth erupts, you should start cleaning the baby's teeth also. That is, tooth brushing should start with the first tooth eruption. You can use a finger brush by the name Pimple Brush. It is available in all the medical shops and other medical supply shops. So you can start tooth brushing. Other than that, to prevent the decay, you can use tooth creams by the name GC tooth mousse. These are nothing but these are made of milk protein. So it is actually safe for the babies even if swallowed. So it is usually given for babies from 6 months of age. So that is one way of preventing the caries or tooth decay. The second way is to give that is professional application. You will have to take a kid to a dental clinic once in a year or once in 6 months and get fluoride gel treatment done. That is what is shown in the second picture. There are silicone trays like this. You fill in with the fluoride gel and it is placed in the mouth for a couple of minutes, and then it is left as such for half an hour. This gives preventive protection, that is the protection against tooth decay to the teeth. And the third is using Pitt and Fisher sealants. That is, when teeth erupt, the back teeth erupt, there will be deep grooves and pits, small elevations and depressions, and it is into these that the sticky foods like chocolates, biscuits, cakes, which kids love, get stuck to. and they cause decay. So what you can do is, as soon as these bad teeth erupt, you can seal them. Those deep depressions and elevations, they are made smooth by giving a sealant. So this is how a sealed tooth looks like. These are the ways in which we can prevent what we saw in the previous slide. If you see, I think a majority of children have early childhood caries. And coming to the treatment, so it is usually for treatment. We don't have many kids coming in for prevention, like for fluoride gel application or pit and fissure sealant application, because of the lack of knowledge. Ignorance is the main reason. So we usually have them for treatment. So what are the different treatments that can be done for children with tooth decay? So if you have a child with a very small decay as shown in this picture, it can be simply filled. This is the filled tooth. We use tooth colored material only these days, so it can be filled and the child will be pain free, because otherwise the child will keep complaining of food getting lodged in between the teeth each time she or he has something to eat. And if it is deep and if there is pain, or if you see a boil on the gums next to the decayed tooth, if you see, or there can also be a swelling on the side of the face as that of the decayed tooth, then we should do a root canal treatment. Root canal treatment is, if see, here the decay is so deep, this black is the decay, it is so deep that it has gone near the pulp. Pulp is the innermost part of the tooth where the nerves and blood vessels are there. So once the decay reaches the pulp, the tooth is very tender, or it is very painful to the child, and it presents with pain or the swelling, as I said. So what we do is we clean the pulp portion where the infection is present and fill it up. This red is the medicine which is placed. We fill the tooth with the medicine so that it stays in place for until the tooth is normally shed. Like if it is a bad teeth, it is these teeth are usually shed by 12 to 13 years. So until then, it will stay in place and it will be shed, and the new tooth will erupt in its position. So that is pulpectomy or root canal treatment. Root canal treatment in children are referred to as pulpectomy. And the most common myth or misconception about root canal treatment with parents is that the roots of the tooth is cut off. But that is not so. It is what we usually do is a cleaning of the roots of the tooth of the pus which has caused the pain, and then filling it up with medicine. So when the child has pain, we often have parents asking us, are in these milk teeth, is it so important to actually preserve them by doing a root canal treatment? Can't we just take them off, like get them removed? But the problem is that these back teeth, which I showed you, they are usually lost by 12 to 13 years. And if you neglect the decay when the baby is 2 to 3 years, thinking that it is only milk teeth, then by most probably by 5 to 6 years, there will be pain and it will be in a state that you should either get an RCT root canal treatment done or get the tooth removed. So what happens if we remove the tooth? That is in this picture. Here, there was a tooth which was prematurely removed. That is, it should have been gone by 13 years. If you get it removed by 5 to 6 years, what will happen? The tooth was removed, and this is the permanent teeth, permanent bad tooth, which erupts into a child's cavity by 6 years of age. So when this is erupting and this tooth is not there, this tend to drift forward. It slides forward, and it is in a slanting position. So one is this tooth is in a slanting position. Second is that by 13 years, when this tooth, this new teeth will erupt in its position by 13 years of age. So this won't have adequate space to come in. So if it doesn't have adequate space, that is, it will either get blocked in the bone itself, and you will have to cut the bone and by orthodontic treatment, that is by fixing wires and brackets, you will have to pull them out. Or even if it comes out, it will be in a malaligned position, that is like it will be out of arch, it will be like this. You will have to ultimately get them removed. So if in case there is a deep decay, and if in case a child is in pain or has a swelling, the first and the foremost thing to be done is take them to a pediatric dentist and take an opinion regarding whether this tooth can be saved by root canal treatment. I'm talking about tooth which is in this condition. And if in case we have to remove the tooth, that is like it is very badly destructed, like these which are beyond repair, or we can't save them in any way, even root canal treatment is not possible, we call them root stumps. These are root stumps. In that case, following removal, we advise a space maintainer. This is a space maintainer. These are ring like appliances which are stuck to the immediately back tooth. This will maintain the space for the new teeth to erupt when it is time. Like if you give it even at the age of 5 to 6 years, it will be in place till 12 to 13 years, and it will provide the space for the new tooth to erupt in its position when it is like by 12 or 13 years of age. So if in case you get the tooth removed, make sure that a space maintainer is put for the child. So something which looks like tooth decay, but that it is not tooth decay, this is enamel hypoplasia. So what is enamel hypoplasia is that the enamel of the tooth will look like defective. It is not properly formed, and you'll see that the tooth keeps chipping or crumpling down, and the tooth appears yellowish to brown in color. These are usually seen in these front 4 teeth and the back tooth. The back teeth which erupts by 6 years of age, those are the most commonly affected tooth in enamel hypoplasia. So what can be done if we start noticing this? See, enamel hypoplasia is most commonly seen in areas like Alapi and other places which are endemic for dental fluorosis, where the fluoride content of the drinking water is very high. That is called dental fluorosis. It causes condition called dental fluorosis, and it presents with these similar stains or the crumpling of the teeth. It looks, the enamel hypoplasia is usually seen in dental fluorosis. So what do we do? If it is in the front teeth, we usually give them a layer of, see, this is teeth with enamel hypoplasia. This is how it finally looks after giving them a layer of tooth colored material, so that it looks like a normal tooth. And the back teeth, if they are very severely affected, see, these back teeth which are severely affected, because they are the ones which bear the load while chewing, and they tend to easily crumple. So temporary steel caps can be given, and later on in adulthood, they can be changed to permanent tooth colored cap after root canal treatment, until like by 20-25 years of age. If the person feels like they don't want a steel cap in their mouth, they can remove it, get a root canal treatment done, and then change to a tooth colored one. But up till 16 years, we usually give only temporary steel crowns or steel caps. Next is trauma to the gums, trauma to teeth, trauma to lips, and this is the most common reason why I receive late night calls, because of kids falling down due to like falling down from the stairs or from their bicycle, or hitting on the side of the table or bed. And these trauma to the teeth per se. I'll talk about the teeth first. So the trauma to the teeth is usually, if it is like a mild fracture, a minimal fracture as seen in this first picture, they can be simply managed by coating it with the tooth colored material and giving it a final tooth-like appearance. And the child usually does not have any pain associated with such fractures. If it is a deeper fracture like this, there is a bleeding point seen. It means that the fracture is involving the pulp. So you will have to get a root canal treatment done, and then a temporary acrylic cap can be placed up till 16 years, and then change to a ceramic cap or whatever you as per required after the age of 16 years. So if it is deep, you'll have to go for root canal treatment, because otherwise the child will have pain. So to alleviate the pain, to remove the pain, we do root canal treatment and then give a cap. The last but the most severe is an avulsion. Avulsion is where the tooth gets removed as a whole from the socket. That is the place what holds the tooth in place. The tooth gets removed as a whole. And what do we do if something like that happens? That is what I would like to stress on, because most of us don't know what to do once faced with such a situation. The first thing would be to bring the child to a pediatric dentist as soon as possible. What should be done at home? You should find the tooth which has come out. It might be like lying on the sand or wherever the child has fallen down. You should try to find the tooth and bring that along with you to the dental clinic. And while holding the tooth, care should be taken not to hold on the root part. The crown part, you should hold it on the crown part. And if possible, if it is soiled, that is, if it is dirty, you should hold it by the crown. See, this is how you should hold it. You should hold it by the crown and wash under tap water. Here, I'm not very sure whether it is evident in the picture. You should wash it under the tap, gently rinse it under the tap water, and if possible, transport it to the dental clinic in milk. Cold milk is the best. Normal milk is also okay. If you can collect the child's saliva, that is also okay. If nothing is, or coconut water is also a good medium to transport the tooth. If none of these are available, normal water, but don't wrap it up in a paper or wrap it up in a cloth and bring, because we are trying to preserve the cells which are there in the root, and we'll try to reimplant, we'll try to replace it back into the socket. So we don't want the cells to die off while you're transporting it to the dental clinic. That is why we stress on the milk, coconut water, or the child saliva or normal water while transportation. And once in the dental clinic, we can refix this tooth back in its place and stabilize it with tiny wires, same like those which are used for the orthodontic treatment, and fix them. So another thing, I've not put the photo here. Another thing which we can take care is that while during sports, children who are engaged in sports, they can use something called sports guard, especially those engaging in boxing, skating, running and all. This will prevent injury to the lips and the teeth. Lip injuries, usually we stitch them up, suture them up, and they'll heal very fast, like in, by around 1 week, they'll heal very well. Next, coming to oral habits. The various oral habits present in children are thumb sucking, as seen in this picture. Thumb sucking is usually considered normal till an age of 2 to 3 years, and after that, if present, it has to be stopped. So it is always best not to let the child engage in it, because once the child is used to it, it is very difficult to bring them out of the habit. So why? Because this can lead to, if you see, once the thumb is placed in the mouth like this, it tends to procline the upper teeth. You see here, the front teeth are proclined, and this will lead to the child keeping his or her mouth open while sleeping, and habitual mouth breathing occurs. We are supposed to be breathing through our nose, but once the child starts to keep his or her mouth open during the sleep, they tend to breathe through the mouth also. So the second habit is mouth breathing. So once we notice the child breathing through the mouth, first is the best thing is to consult an ENT first, because the child could be breathing through the mouth because of enlarged adenoids, and because of which the child is not able to breathe normally through his nose. And so it is usually after an adenoidectomy, that is a surgery for the adenoids, or some spray or medicines are given by the ENT for these adenoid problems, that gets resolved. Once that gets resolved is when we usually intercept the mouth breathing habit by giving an appliance. We give them something, an appliance to wear during the daytime, while they are not attending classes or going out, while they are at home, and during full time during the night. So with that, we can intercept the habit within like 3 to 4 months. So these mouth breathing habits are usually intercepted after ENT consultation. And lip biting, as seen in this, has it should also be intercepted as and when noticed, because all these three habits will eventually lead to the tooth getting proclined. Mouth breathing will lead to, you can see the shape of the face. This is a typical face shape which is seen in a child with mouth breathing habit. So all these are intercepted with appliances, and usually the correction, we can achieve the correction within maximum of 5 to 6 months. So growth modification, many of us would have come across children with conditions like this. This is like there is deficient growth of one or both jaws, or there is an excessive growth of one or both jaws, either ways. Here you see the upper lip is slightly back and the lower lip is front, which shows that the upper arch is, the growth is less and the lower arch growth is more. And here it is the reverse. So if you see these type of conditions, it can best be corrected by 7 to 8 years. You can see the correction achieved. So what most parents don't know is that these can be corrected during the growing age of the child, that is like starting from 7 to 8 years. And if not corrected at this stage, and once the growth is completed, then this growth can be corrected only after 16 years of age, and that too through surgery. So there are various appliances which help in achieving, we can achieve, modify, or restrict the growth of the jaw bones. These are some types of appliances which we use to modify the growth. These are usually worn during the night time, and like 2-3 hours during day and throughout the night. And you can see marked difference within 2 to 3 months of usage itself. These are extraoral, that is worn outside the mouth, and these are intraoral appliances which are given for these similar conditions. And once we achieve the growth of the skeletal system, that is the bones, we usually finish them off with an orthodontic correction, that is by applying wires and brackets. We complete them with the orthodontic treatment after the age of 12 to 13 years. That is once all the permanent teeth erupt into the mouth. And orthodontic treatment, we have there are many doubts regarding whether teeth needs to be removed or not. That is depending on each case, like depending on the space available. If we need space, we'll remove.
You can share it.
Is it visible now?
Yeah, it's good.
I'm not sure till where I had presented.
Major part completed.
Oh,
This is the thing.
Yes, that's
okay. Ugly duckling stage. So this is what yeah, this is what usually happens by 9 to 11 years of age, and it is a self-correcting anomaly. That is, like, it gets corrected on its own. This is mainly because of these large canine teeth, that is the corner teeth, hitting onto the roots of the already erupted teeth, causing a space to happen in between. And this will go off once these teeth erupts in position. So there is nothing to worry about or apprehended about. This gets corrected on its own and it doesn't require any treatment. So coming to pediatric dental surgery, there are various conditions which require surgical corrections. One is cleft lip and palate. That is, you have the cleft of the lip as well as the palate. That is the inside of the roof of the mouth. So the correction starts usually by 2 to 3 months. That is the surgical part, and it is usually corrected in stages. But otherwise, the other treatment or the management starts soon after birth of the child, because to enable the child to suckle mouth, we have to give them appliances and other to facilitate suckling. We need to provide help. So that starts soon after the birth, but the surgical part usually starts by 2 to 3 years of months. And nowadays, the reconstruction and the repair of these cleft is so great. The results are so amazing that it leaves behind minimal scar. If you see this picture, you see that there's absolutely, there'll be scar, but it is very minimal, that it is actually negligible. So when corrected early, the defect does not affect the growth of the jaw bones and also the child's speech. That is very important. You should get it corrected as early as possible so that the child will have a proper speech. Now, these are very rare conditions. These are like, there are two types. We refer them to as mucosal. This is actually called a ranula. That is, the saliva is produced by salivary glands. There are glands within the mouth which produces the saliva. So the passage of the saliva gets blocked, and the saliva tends to pool, and it becomes a bubble-like appearance. So in a newborn, when it usually happens, this is the picture. The tongue is often raised, because of which there will be difficulty in feeding, and this can be surgically corrected. This is a surgically corrected case. So you can either get them surgically corrected, or there is cauterization. That is, you use instruments to slightly burn it off. That is like I'm using the common terms. It is not actually burning, but cauterizing. We call it cauterizing. Remove it using heat. The second type of ranula, this is usually seen on the undersurface of the tongue, below the tongue, which causes the tongue to be raised. And this is another type of mucosal. The same thing happens on the lip. Lower lip is the most common place where it is seen. This is a corrected picture. This is again due to the child accidentally biting on the lips, and there is trauma to the passage of the saliva, and that duct gets blocked, and there is saliva pooling, and there is this bubble-like appearance on the lip. That again can be corrected surgically. So these are the surgical part of pediatric dentistry. Next one is the tongue tie, frenectomy. That is, there is, like, normally there is band of tissue that attaches the tip of the tongue to the floor, not the tip of the tongue, the undersurface of the tongue to the floor of the mouth, and the tongue can move in all the directions. But once this attachment is to the tip, it will restrict the tongue movements. So this will affect the child's speech, and because the speech is affected, the overall psychological development also, the child will be very conscious because the speech is not proper. So this is best to be corrected even before the child begins to speak. And if it is in the upper arch, like if you pull your upper lip, you'll see another muscular band which connects the upper lip to the gums, upper gums. So that if it happens in the upper arch, if it is not properly attached, that is the attachment is too low, that is it is in between the two front teeth, then this can be corrected first by surgery, and then the space can be closed orthodontically with using wires and the brackets. The last part, there are more, but I'm just telling you the most common conditions. This is what is called the mesiodontis, that is a supernumerary teeth, that is an extra tooth which is found. Usually there are 32 teeth, but there will be extra teeth which are present in the normal set, in addition to the normal set, and the most common extra tooth is a mesiodontis. That is the most common one to be present is right in between the front teeth, and this tooth can cause these teeth to be positioned in a certain unfavorable position. So these extra teeth should be removed as soon as possible, and the front teeth should be orthodontically corrected to bring it back to normal alignment. All these are not very time consuming procedures. These can be actually done and corrected in like 1 to 2 months. The last but the most important is the conditions which are present in special children. Special children are those with the physical, mental, and emotional handicaps, and we require special care and treatment for these kids. So these kids, and also these special kids, and also very young children who are unable to comprehend and cooperate for a treatment, like those kids who are less than 2 years of age, but they have a deep decay, they have a pain, and they need treatment, then it becomes necessary for the treatment to be carried out under general anesthesia. That is, in a hospital setup, we give them general anesthesia. The dentist does only the dental part. The general anesthesia is given by the anesthetist after a full pre-anesthetic checkup, and after certifying that the child is fit for anesthesia. And it is actually a totally safe procedure, and it is a very convenient and comfortable procedure for the child also, because the child sleeps throughout the procedure, and all the procedure, like if you see this condition, for example, there are multiple teeth which will require root canal treatment, there are multiple teeth which will require removal, there are teeth which will require filling. So while treatment is done under general anesthesia, the treatment usually takes place in over like 1 to 2 hours, and all the treatment, the comprehensive treatment is given to the child in that 1 to 2 hours, and the child's mouth is rehabilitated. There is a full mouth rehabilitation done so that he or she will not require another dental procedure in the near future. Like until these teeth sheds, there won't be another dental treatment required. So after like 12 to 13 years, once the child is capable of cooperating for the treatment, it can be done on the dental chair without any anesthesia. So with this, I think I've covered briefly everything that is related to pediatric oral health, and how an early intervention will help us maintain healthy oral environment with simple treatments. So it is actually the early intervention, that is, as soon as you notice a decay, get it filled, or you should try to prevent the tooth decay from occurring. So early intervention is the key. So I thank you for your patient listening, and this is my WhatsApp number and email ID. If at all you require any assistance or any help, I'm ready to help. Please feel free to contact me. And if there are any queries, I'm ready to answer them too.
Yes, ma'am. Thank you so much, ma'am. So you have explained a lot about this, ma'am. I too came with a lot of questions for my kids. My doubt has been cleared in your class itself, ma'am. Thank you for that, ma'am. So this is questionnaire session. So anyone want to ask questions to ma'am, you can raise your questions and clear your doubts with ma'am. Yes.
Okay, I want to
So,
ask one question, ma'am.
yeah,
So,
yes, yeah.
yes, ma'am. My niece, she is 7, and then she was undergoing pulpectomy, and then she was fine at the clinic. But then after she got back, maybe we don't know, maybe because of the dose that has been used or because of which one, we really don't know. But it seems she had a nightmare. So what shall we do in order to cope up with those, since you also had a brief knowledge about child psychology, no? So ma'am, can you please provide some encouragement?
Yeah, yeah. The main point to be remembered here is taking the child to a pediatric dentist. I'm not saying that other dentists don't know, but dentistry as such, there are 7 to 8 specialties, and like a root canal specialist does the root canal well, better than maybe like better than I can do. He or she may be able to do a root canal treatment. Similarly, there is somebody called a prosthodontist who replaces a missing tooth. So each specialty, the specialists are they are trained to do that treatment very well during their post graduation days. So it is always better to take a child to a pediatric dentist. There are many like general dentists also doing pediatric procedures. The pediatric dentists are trained in child psychology too. So the approach is different. So rather than uh, getting the child scared or making him or her afraid of the treatment, showing them, taking time to explain what is being done to them and then doing it makes a lot of difference.
Okay.
They tend to cooperate for the treatment. So actually they cry because of their fear. They don't know what is going to happen there. It is because of the fear of the unknown that they are crying. So once they get to know, once you demonstrate what is going to be done to them before doing it in their mouth, like showing it in their hands or explaining it to them, that actually creates a better environment for treatment. It is because the child got scared that he or she has got a nightmare. So
Yes.
like one thing is, before taking to the dentist, you should actually prepare the child at home. You have to prepare the child. You can tell like they'll just wash your tooth, take off the bacteria germs, and then fill it with a material like chocolate colored material, we say Kinder Joy material and all, so that they look forward to what is going to happen. They are prepared for the appointment. Then they come, and once they come, we can actually tell them what is going to be done before doing it. Usually, kids are like parents scare the kids, saying if you don't eat properly or if you pouch your food in your mouth, your teeth will get spoiled. You will have to go to a dentist. You will get injection there or get it removed. So that negative feeling or the negative thought is already there in the child's mind. If I go there, I'll get injection, I'll get my tooth removed. So they come with that fear. So prepare the child. Rest the pediatric dentist can do it.
Okay,
It is
thank you so
not.
much, ma'am.
Yes, thank you.
Yes, good evening, doctor. This is Sarita. Actually, I have a doubt, doctor. I used to floss my teeth, and my child, she is just 12 years old, and she has also started flossing her teeth twice. So, is it proper for a child to floss the teeth?
Yeah, 12 years, she'll be having almost all her permanent teeth erupted by now. So
Yes.
flossing is actually okay. Flossing is the best way to get the food out of the interproximal areas, that is the space between the teeth, uh, provided it is done the right way.
Okay.
So sure, it is being done the right way. Like get a demonstration done from your dentist, or like take 15 to 18 centimeters of floss, tie it between your index fingers. And how you floss is most important. For upper teeth, it is always you put it between the teeth and pull it down. To go further up, you will enjoy your gums. So if it is properly done, it is very good. If it is not, like, if it is the incorrect way, it can lead to gum problem. You know, you can cause gum problems because of incorrect flossing techniques.
Oh, that will lead to an increase in the gap between the teeth, ma'am?
That will, it will eventually cause a gap in between the teeth, because once you start injuring the gums gets inflamed, and because of the gum inflammation, there will be food lodgement in between the teeth, you know, because of the gum inflammation, and that will eventually lead to gum problems and spacing in between the teeth. Not maybe for your daughter, because she's too young, but eventually that will happen if it is not done properly.
Okay, okay, thank you.
I think Ananti ma'am got disconnected.
Okay, ma'am. My sister, when she was studying in the school, means adult time, she was small. One of the friend pulled her out, and she fell down, and her teeth, one of the front teeth has broken little bit, and we thought of it will be okay. Then afterwards, now she's grown up, and now she's having pain. Sometimes she's having swelling and all, and we had done root canal. After root canal also, she got pain again. So the doctor told her to fixing. That means there her means a portion, the teeth portion had means that, and the doctor told her to fixing new teeth instead of that teeth. So is it good for means it's look good, or it's still good, ma'am?
How old is she?
Now she's 20 years old, ma'am.
Fixing another, what is the doctor saying? Like putting the cap or putting an implant?
Yes, ma'am. Putting the cap, ma'am, because sir,
putting the cap is okay. And after looking at it, you are supposed to put the cap to safeguard and preserve the tooth. I think there's some disturbance. Yeah. To preserve the tooth which is root canal treated, it is always best, or it is mandatory, that you put a cap for the tooth after the root canal treatment. But if you what you said is like after the root canal treatment also she had pain, then that has to be looked into, because usually root canal treated tooth, if it is done properly, won't have any further pain episodes. So first that has to be looked into, whether the root canal treatment has been done properly, whether the filling is proper, what has caused that pain after the root canal treatment, and that has to be solved. And then obviously the cap has to be put.
Thank you, ma'am. It's interactive section. Please ask questions.
Yes, ma'am. Ma'am, I have a doubt that my son is 4 years old, ma'am. And right now he had tooth pain, ma'am. And I consulted doctor, and she filled that area. But after some days, again he had pain. So the doctor suggests that now he is not well. So after that, she said that come to the hospital, and she said that maybe we can do the root canal and all, ma'am. So is it necessary, ma'am, for doing the root canal for the 4 years old child?
Yes, that this is exactly what I was talking about. See, root canal treatment is nothing but the filling. We are taking away the infection from the root portion of the tooth also, and filling it up, just like we fill the tooth. Just like now baby has got a filling, the root of the tooth will also be filled after taking away the infection or the pus which is inside. Now what has happened is, what exactly has happened to the baby is there was a tooth decay which was deep.
Maybe. Yes,
That
ma'am.
deep decay, in which actually a root canal treatment should have been done. That is, there was already pus in the pulp area. So that pus was not taken away. Before that, it was just simply filled. That is like sealing the tooth.
Yes,
So
ma'am.
there is
Correct.
pus inside and it has been sealed from the top. So the channel for the pus to go out has also been blocked.
Yes, ma'am.
And that has caused the pain.
Pain.
So
Yeah.
So that has to be removed. That is, the the pulp chamber where the infection is residing right now, that has to be cleaned and that has to be filled. That is root canal treatment. There is nothing to worry about, and age is
Ma'am,
not a bar for canal treatment.
okay, but ma'am, yeah, but it's take pain, ma'am, for him. Maybe I don't.
No. There are two ways of doing root canal treatment. One is, if the root canal treatment is done on a tooth where there is already a boil or a swelling, that means the tooth is already dead. It is non-vital.
Oh, okay.
So that tooth doesn't have any pain sensation. So for that tooth, there is no need for anesthesia. We don't give an injection to numb the tooth before root canal treatment. But for teeth which has pain, we usually give an anesthesia, that is an injection to numb the tooth. And this injection is not like the big like the big needles which you use for your vaccination. These are very small insulin needles. The child hardly will know that prick being given. So there is absolutely nothing to worry about pain part, because if it is a vital tooth, that is, if it is a live tooth, then the tooth will be numbed before the procedure.
Okay, ma'am. And ma'am, which type of toothbrush you have to suggest for the babies, ma'am, for the child? Toothbrush. Yeah. Yes, ma'am.
Soft bristled baby toothbrushes are available.
Soft, yeah.
And Colgate, or all these, like Colgate Kids toothbrush and paste are commonly available in all the supermarkets also.
The soft type brushes, right, ma'am? Yeah. Okay, ma'am. Yeah. Thank you, ma'am.
Yes, ma'am. So shall I ask one more thing, ma'am? I have to clear whether I have understood correctly or not. For that, I'm asking. Okay, ma'am, you have said no. The teeth which has been premature teeth will be there, and after that, if the teeth was like spacing was there, means something extra teeth that like that only, no, ma'am. Extra will be growing so that it will get proper. Am I correct, ma'am?
I didn't get you. I'm sorry, I didn't get you.
Okay. Let me say the first problem first. For my son, no, ma'am, before the milk teeth has been, before it fell down, the teeth has grown already inside. Okay, but we didn't do anything. After that, the real teeth has fallen down, and then that teeth came front. No, nothing problem was there, but it became flattened. It was like very big, and space was there between the front teeth, two teeth. No space was there. So whether we have to correct that or am I stuck? No, ma'am.
No, ma'am. No, ma'am.
We can hear you, ma'am.
I think Meena ma'am has
Okay, yeah. Yes, ma'am. So her video is freezed.
Yes, ma'am. So
yes, ma'am. It was really a nice session. I hope it's you know, when we listen to all her points, I realize it's useful for everyone. Let's say like yeah, for the mothers it's very useful, and even if the viewers are already grown up and they don't have kid anymore, it will be useful for their grandchildren also. For those who are not yet married, those who are not having child, it will be very helpful for them also. So it has been very beneficial for everyone, right?
Yes, yes,
Yes,
Urmila.
ma'am.
What
Yes,
a-
ma'am. Yes, ma'am.
Okay,
Because
let's go.
we are knowing more about the small newborn baby itself having the protection of the teeth, no? So we
Yes,
are getting
ma'am.
more knowledge. That was the really, because nobody knows.
Then
I think
knowledge,
it's not
ma'am.
aware of
Then
such things. The
our
newborn babies also having.
period.
Yes, ma'am.
Okay, ma'am is reconnecting.
Then knowledge, I think then knowledge will be having some fear on our kids. So what will happen, whether it can be done, whether it can't be done. So that fear will get rid of. That is the main thing.
Yes, ma'am. It
Yes,
has
ma'am.
been
Yes,
so
ma'am.
beneficial.
I'm
So
so
yes,
sorry, I lost my connection.
it's fine, ma'am. It's okay, ma'am. So Ananti, ma'am, you can repeat your question.
Yes, ma'am. So that's the thing, ma'am. So the teeth has fallen out. So that the
Okay.
teeth before fallen, it has grown, no? That became front and it was normal. It was not like this, nothing was there, but it became more flattened and space was there between the teeth.
Okay.
Then he says whether it was looking awkward for me, like that he was asking me. I don't know whether to say it is okay or normal or we can do something. He's
How
only
old is he
7
now?
7 years, ma'am.
7 years. That is okay. Like
It will become
it
normal,
is
ma'am.
right now in proper. It is right now in proper position, right? It is not behind.
No,
Like
ma'am,
it
not
is in the same.
no, not
All
behind.
right.
It is proper position, but space gap was there.
The spacing is okay. It will go off once the canine, the corner teeth erupts. It will go off. Even for the lower teeth, to an extent, that space will get closed by around 11 years of age. When the other teeth
Okay.
erupts, because of the pressure, these spaces will close.
Okay. Why it became flattened, ma'am? Before it was only small, now become big and flat.
It is not actually flattened. We feel it is flattened, or it is like too big, or it is yellowish in color. All this because we are comparing it with the small milk teeth which was initially present. Like even for us, if we ask our parents, they would have also felt the same thing about our teeth. But once all the milk teeth goes and permanent teeth has erupted, it will all look the same. We wouldn't feel anything awkward about it. But once it is like a few permanent teeth along with the milk teeth, when it is present in his mouth, we start comparing with the milk teeth, and we feel that this is flattened, this is too big, this is very yellow. It naturally happens, but it is actually the normal color, the normal size, and it is not flattened.
Okay, ma'am. Thank you so
There is
much. Yes, ma'am. Yes, ma'am.
So any more doubts?
Yes. I'm having, ma'am. I'm having. So for my daughter also, no, ma'am. You have said no. After we were feeding, we have to clean it with a cloth or like that. I think I have missed that part. Now she is 4 years. She will be having in front teeth alone, like what to say, something will be sedimented on sedimented way. It will be, ma'am. And sides of the tooth will be like the shapes, no, it will be reduced. I think it will be powdering and then it will fall off, I think. Whether it can be that is milk teeth only. So you have said about paste and all, fluoride paste. So anything additional thing before I can do for that, ma'am?
Yeah, that GC tooth mousse which I mentioned about, that is the best thing you can use.
Okay. The teeth, no, side wall of the teeth
That is like it wouldn't like bring the tooth which is it. Yeah, that is how it starts. So if you use the GC tooth mousse, this decay, it wouldn't go off, or it wouldn't like you shouldn't expect once you start using that cream, the tooth to go back to how it was a normal, healthy tooth. Why we use that cream is because we don't want it to go become worse any further. So it will arrest it at what condition you are starting to use the cream. It will maintain the tooth in that position, in that condition, so that you don't have the child won't have pain, or the decay won't go deeper. It won't cause any infection as such. The fluoride application has to be done by the dentist. The cream, you can apply it every night for half an hour, or just after, if the baby is not being breastfed now, at night time you can apply and put him or her off to sleep.
Okay, ma'am. Thank you so much, ma'am.
Thank you.
Yes. So anyone want to ask question?
Every doubt has been cleared by ma'am. You have explained everything in a very beneficial way. So thank you so much, ma'am.
Thank you so much.
Thank you, ma'am.
Yes, Yomi, ma'am.
Yes, ma'am. Minu, ma'am, shall we call Ananti, ma'am, for the word of thanks?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Let's wind up. Before winding up, we have to thank to everyone. So let us welcome Anandi, ma'am. Welcome, Anandi, ma'am, for the word of thanks.
Thank you, ma'am. So good evening, my dear ladies and gentlemen. It gives me a very immense pleasure to deliver this vote of thanks for this event to our dignitaries who are available here. So I would like to extend my thanks and express my gratitude to our resource person, Dr. Meenu Prasanna ma'am, who is a pediatric dental specialist. Your presence was, it's a very good contribution to us today, ma'am, to make this webinar as a very successful one. And I extend my gratitude to Baba sir, our master trainer, and our Rising Spin Circle coordinators, evaluators, and all the NCDC faculties and members of the NCDC family. Last but not the least, our beloved participants and volunteers who listened patiently and raised questions and also clarified their doubts, which makes this webinar a very great success. So I believe you all benefited with this wonderful webinar, and ma'am has said if you all having doubts, you can contact her. She's there to help. So you also can contact them, and if you want a number also, you can contact our Rising Queen Circle. So we will be getting that number to you. Okay. Thank you so much. Thank you, ma'am. Once again, and thank you a lot, ma'am.
Thank you, Ananti, ma'am.
Thank you, ma'am.
Thank you, Anandi, ma'am. And also special thanks to Meenu Prasannan, ma'am, Dr. Meenu, ma'am. Thank you so much, ma'am, for coming here, giving your valuable points, which we all want to know about our child's dental problems. So that's very good information and very good valuable points. Thank you, ma'am. Thank you so much. Thank you.
Yes, ma'am. So we can end the live session.
Yes, ma'am. I think Sherin ma'am got disconnected. So I'm sure she must be also very thankful, and she must be also very grateful. So for her sake also, once again, I'm thanking our Dr. Meenu Prasannan ma'am. Thank you so much, ma'am. So we are looking forward to see you another time also, ma'am.
Sure, sure.
Okay, so
forward to it.
So thank you all, and God bless you all. Have a great evening.
Thank you.
Thank you all. Bye.
Bye.
Bye.